So Larry, do we have the right light bulb for these lights?
72-year-old Marvin Harvey leads an active life with his wife Barb, running this hardware store in rural Vermont. A few years ago, he noticed he had the urge to go to the bathroom more and more, waking up sometimes 8 times a night.
It was a inconvenience, to say the least. It was so frequent, I should say, that I basically, it was embarrassing as well as a nuisance. I could be in a conversation with somebody on the job and so forth, and I'd have to go and urinate.
It can also be stressful on a marriage. Marv's wife, Barb, says that her husband's frequent pit stops often added time to their travel plans.
And at times he'll have to stop every 45 minutes or so to use a restroom. It's very annoying.
Marv was diagnosed with BPH, benign prostatic hyperplasia, better known as an enlarged prostate. This very common but non-cancerous condition affects 50% of men over 50 and up to 90% of men over 80.
Just because you have enlargement of the prostate does not necessarily mean you're at risk for prostate cancer.
Dr. Glenn Preminger is a professor of urology at Duke University Medical Center.
This is a model of the bladder and the prostate that's located directly below the bladder. Notice how the water channel, or the urethra, carries urine directly through the middle of the prostate. This can be a problem if the prostate becomes enlarged.
BPH can be easily diagnosed using urodynamics, which involves putting a small catheter into the bladder.
Can you give us a cough?
If I could talk to every man and tell them when to come and talk to their doctor, it would be at the time that they were beginning to have problems. The sooner we're able to start reversing the process, the better they're going to do. Because some of these processes are very easy to reverse or stop in their tracks, and if caught at an early stage, the implications for the patient are much better.
Do you have any questions about your procedure today?
There are a number of treatments available for BPH. They fall into 3 main categories: drugs, office-based procedures, and surgical therapies. Fortunately, the surgical options now available for patients include less invasive procedures that use holmium laser energy. These procedures are performed with the VersaPulse Power Suite laser and its specialized laser fibers.
HoLAP, which is holmium laser ablation of the prostate, is for a small prostate, and typically we're talking about one that's 60 grams or smaller, which is roughly the size of a golf ball or smaller. HoLEP, which is holmium laser enucleation of the prostate. For larger prostates, it's a fantastic procedure, and I do believe it should be the gold standard. So as far as treating the prostate, I think the laser is ideal for this purpose.
Today, based on his doctor's recommendation, Marv Harvey has elected to have the HoLEP procedure.
So for my retired patients that may like to play golf or tennis, all I need to do is ask them to take a week off, and then I can get them back out. I think this has really impacted people's life because it just gets them back up and running. And men who typically like to come in, fix the problem, and get back to what they were doing, I think this is a good setup for that. It's all done. Things went beautifully. You did great. You know, rock stable the whole time. Things went really beautifully.
A couple of weeks later, after his HoLEP laser procedure, Marv is shoveling snow and is back on the job.
I can see myself coming back into during a healing process, you would, mentally as well as physically. And I'm very optimistic about what the future is going to hold for me.
Marv is able to stop taking both of the drugs that he was on, and this is a big advantage for him. He was beginning to have side effects, and we're both pleased that he's able to stop taking the 2 drugs.
A patient should talk to their doctor when the symptoms start to get in the way of their lifestyle. If having to get up frequently at night to urinate or having to go to the bathroom more frequently during the day is getting in the way with one's lifestyle, then it's definitely worthwhile to talk with the physician.
I lived in Vermont for a long time, and I like to tell my patients that they would be writing their name in the snow, which is something that so many of my patients could never imagine doing except when they were 15. And I have patients that will come back and tell me that it's just fabulous how much it has improved their life and the quality of their life.
For more information about treating BPH, ask your doctor and visit these websites.